If you want to get rid of wrinkles under the eyes, do not make this one mistake. This sock is going to teach you about why surgery under the eyelids causes some of the worst complications that I see in my practice. The skin pinch eyelid surgery is advertised as like a quick fix that's going to fix that crepey, wrinkly skin under your eyes. But this popular procedure, when performed in isolation, can have a big risk to it that can change the shape of your eye. And a lot of surgeons are not necessarily telling you that before you have the procedure. Let's go back to our sock example. If I were to tell you that in order to fix the bunching of your sock around your ankle, you should just cut out the fabric at the bunching part and cut out the wrinkly parts, you would look at me like I'm crazy, because obviously it's the tightness and the elasticity of this part of the sock that makes a difference in terms of how the sock fits and whether it bunches around your ankles. The same mistake is made with eyelid surgery. Somehow people have it in their heads that if you just take a little bit of skin, it doesn't matter what's going on with the tendons and the support structures above it, it'll somehow just fix the wrinkles. And yet what it will actually do is it'll pull the eyelid down, just like if you tried to put the sock back on, it would be foreshortened and you wouldn't be able to lift it back up. So what is this significant risk? It's something called lower eyelid retraction, or pulling down of the eyelid so that you can see the white part there. And it just kind of looks a little bit ghoulish or like a zombie. So if a skin pinch on its own is a bad idea, then what can you do to prevent this problem of eyelid retraction from happening? Let me tell you the one thing that you need to ask your surgeon if you are considering a skin pinch procedure. Specifically, you need to ask your surgeon, if you're going to remove some of the skin under my eyes, what are you going to do to support the structures around it so that I don't get sagging or drooping of the lower eyelid or lower eyelid retraction? The gold standard for preventing this complication is to do something called a canthopexy or a canthoplasty at the same time as removing skin to support that support structure while you're also pulling some of the skin out. Think about it this way. A skin pinch is subtraction, a canthopexy is reinforcement. For most patients, the safest and most effective way to address lower eyelid wrinkles involves some combination of both. Your most important next step is to schedule a consultation with a qualified, board-certified surgeon who does lots and lots of eyelid procedures. The idea of a quick skin pinch is tempting, and I understand it. But the reality is the lower eyelid is an exquisitely complex and delicate structure, and I see problems from other surgeries that happen to people on an everyday basis.